Hello, my name is Dr. Chris Williams, and I'm your host on Well Again. Excuse me. Well Again is your online health magazine program in which we explore lifestyle, dietary, and nutritional alternatives to recovering from sickness and staying in health. Thank you so much for joining in today. Before I introduce us to what we have to say today, I just wanted you to know that we desire that you subscribe to this channel, and then also turn on your notification button so that when we do new videos, you'll get the notifications immediately we upload. Also, follow us on Facebook. We're on Facebook. Chris Williams is the Facebook, and then also send this URL to other people, people you know you need this, so that we'll be able to reach more people. Literally help somebody by dispersing this information. All right, thank you so much for joining. Also, if you need if you feel like this, you should place some kind of advert or so, or sponsorship here, you can help do that, and then we will really appreciate that. All right, there are some other products we have in our kitty, and we'll be introducing you to them. We are into real estate developing and building of estates, and if you're interested, you get to know more about them. Thank you so much for coming in today. Today we are discussing dizziness, okay, and I decided to talk on this about 7 days ago. When I was later than that, I was at a place and I saw a dog. The dog was dizzy. He couldn't walk. He was literally behaving like somebody who was drunk, being thrown here and there. And then he would try to walk. I think the dog was very hungry. He would try to walk, try to look for something, but we'll see that he cannot do it. Then we'll go and sit down again, and then he will go again. And I was wondering, I said, only if I could talk to this dog, I might just be able to help him. Then it occurred to me, but you have not helped human beings who are dizzy. So I decided to talk on something on dizziness. Okay, dizziness is commonplace, and it is the feeling of being lightheaded, woozy, or imbalanced. The feeling of being lightheaded, woozy, or imbalanced. It can lead to a fall, or it can lead to a fainting if it is too dramatic. Okay, it's a symptom. It's not a disease, but it's a symptom of many other diseases. There are 3 categories of dizziness. There's vertigo, and this is the worst of them. It's a spinning sensation that you can feel, and it will look as if the room in which you are in is turning around. I remember my dad used to suffer this many years ago, and we couldn't understand him. I was wondering. He would just grab hold of something. He would say, it looks like the room is moving. I said, this man, but he doesn't drink now. Well, he used to drink, but he had long stopped drinking before now. I said, what's wrong with this man? You understand vertigo. All right. So it looks as if the room is spinning, or that maybe you are tilted, and that you are seeing things from a tilted angle. Another category of dizziness is disequilibrium. Is simply loss of balance. You are walking and then you lose balance, and usually this is due to some fault or the other in the musculoskeletal system. And then there's also dizziness. Sorry, there's proper dizziness, the one that is properly called dizziness. It's a feeling of lightheadedness or near fainting, a feeling of lightheadedness or near fainting. Okay, it's nothing serious if it happens once in a while, but by the time it has become a chronic thing, then it's a cause for concern, because usually it shows that something is not right with the body. What are the causes of dizziness? There's migraine. Migraine can cause dizziness. use of medications. Some medications can cause dizziness. Some medications used to treat diabetes or treat hypertension or some other things can cause dizziness. Okay, chronic alcohol abuse being drunk can lead to dizziness, but when somebody also abuses alcohol chronically, they can begin to feel dizzy even when they have not drunk, okay, or drank, sorry. Okay, so if you also have inner ear problems, either an infection or a swelling or a tumor growing there or something or the other, it can cause dizziness. Okay, there's a part of the inner ear called the cochlea. It is the organ, it is the center of balance. Okay, when it is infected or when it is inflamed or there is a growth impinging on it, it can lead to imbalance, which is dizziness. There's also benign positional vertigo, and it can cause dizziness when somebody changes position, especially when you do it sharply. For instance, if you were lying down, you sit up sharply, you can feel dizzy, or you were sitting down, then you lie down, you can feel dizzy. Okay, there's also Meniere's disease. Meniere's disease, it's a condition in which there's fluid buildup in the brain, okay, in the inner ears. And this, just like we said earlier, once there's anything not right with the inner ears, it can cause dizziness. So there's fullness, but Meniere's disease is always accompanied with some degree of loss of hearing. Okay, and then tinnitus, ringing in the ears. Also, there's acoustic neuroma, tumor in the inner ear, tumor of the nerve there can cause dizziness also. Okay, so and then some other causes of dizziness: sudden drop in blood pressure. Sudden sharp drop in blood pressure. Somebody is and it usually happens when people like change position. Maybe you were standing up and then you change position, and then maybe your blood pressure was 130/80, and then pam, it goes to 160/100, for instance. Those kinds of things can cause imbalance, which can lead to dizziness. Decrease in blood volume, so dehydration, chronic very bad dehydration can cause dizziness. Also, anxiety disorders. When somebody is battling anxiety, dizziness is one of the things that can present along with many other things. Anemia, low PCV, okay, low hemoglobin level, it can lead to dizziness. Also, hypoglycemia, low blood sugar, especially when it is down below like 70-60, it can cause dizziness. All right, hypoglycemia can be two types. There is the reactive type, and there is the fasting hypoglycemia. Okay, so hypoglycemia happens, chronic hypoglycemia, that's what we're talking about, happens if there's something wrong with the pancreas, or there's something wrong with the liver, okay, like a chronic liver disease or a chronic pancreatic disorder. It can lead to hypoglycemia, which can lead to dizziness. Ear infection, especially of the inner ear, we have said it. Dehydration, we have talked about it. Heat stroke can also lead to dizziness. The people who have tried to go to Europe through the Sahara Desert, they will tell you that excessive exercises, when somebody exercises too excessively, can lead to dizziness. Motion sickness, some people, once they're in a moving car, they have a lot of dizziness. And the multiple sclerosis and also stroke, all these are the causes of dizziness. Now, what are the symptoms? How does dizziness present? We've tried to describe how it presents. Lightheadedness of feeling faint, and then false sense of spinning, like in vertigo, or benign vertigo, like postural vertigo, like we saw earlier. Okay, it's also accompanied with unsteadiness, loss of balance, and feeling of floating or swimming. It looks as if the person is swimming or the person is floating. If it's really bad, it can be associated with nausea, it It can be associated with vomiting. It can be associated with fainting. Yeah, okay. The person, it can literally lead to a fainting. Okay. Now, this is very important. This thing I want to say now. If dizziness occurs alongside with you are having headache as well, or you are having dizziness 3 days, 4 days after you had an head injury, or you have neck pain alongside dizziness, or you have high fever alongside dizziness, or blood vision alongside dizziness, or hearing loss alongside dizziness, or speaking difficulty in speaking, or numbness or tingling either in the hands or the feet alongside dizziness, or a drooling of your mouth, drooling of your eyes alongside dizziness, you need to see a doctor. You need to see a doctor. If there's also loss of consciousness alongside dizziness, then there's an issue when the person needs to be taken to the hospital. So if there's also ongoing vomiting alongside dizziness, then you need to see a doctor. Maybe there's some increased intracranial pressure, and then the person needs to be seen by a doctor. How do you manage dizziness? Number one, diet. You need to change your diet. All the things that can lead to hypoglycemia, and all the things that can lead to all the things we just said now, if you control them, you may be able to deal with dizziness. So diet, stop eating animal proteins except maybe fish, and make sure the fish is from the wild, not farmed fish. Very important. And then take the dried ones. Okay, grill your fish. Okay, eggs, milk, remove them from your food. Beef, chicken, turkey, remove them from your food. Also remove anything made from pastas, anything made from flours, pastas, pastries, confectionaries, semos, noodles, spaghetti, macaroni. Remove all those from your food. Very, very, very important. Also, anything that is sweet to your taste, especially sweet fruits, and sweet fruits like pineapple, watermelon, or soft drinks, carbonated drinks, all those kinds of things, remove them from your food. Remove alcohol, remove coffee from your food. Stimulants, generally, remove them from your food. And stop using lorry loads of MSGs, these spices that they use to cook food, to cook your food. Colorings, flavorings, all these things destabilize your body. You want to remove them. What else do you do? Distress. Stress is a very, very one of the foremost causes of dizziness. Cool down, relax, distress yourself. And over time, we have talked about several R's that can help you to distress. Recognize the stressor, remove the stressor, recondition your life and your heart. Don't let things stress you. Unworthily. Okay, some people just like giving into stress. All right, and then recondition yourself, build right relationships around you, rest a lot, rest adequately, 5 to 8 hours a day of protected resting, recreation, relaxation. All these things can help you to distress. And then also taking supplements that help to distress. Supplements like chamomile, like passion flower, like lavender, like skull cap. Okay, these lemon balm, these are calmative that can help you, that can help to calm you down. Also, have your inner ears checked, or if before you can do that, you can get ear drops and then use them. Ear drop, antibiotic ear drops, you can use them and see whether there's an infection building up there. Or you buy Serumol drops. Serumol helps you to clean out your ear. You put it in this one here, you stay there for like 10 minutes, and then you turn it out, and then you put it in there. And then if you do it for like 1 week and see if it will go. For many persons, by the time you use antibiotics and you also use Serumol, some wax that has built up in your inner ears will come out, and the dizziness hopefully may disappear. Okay, if there's Meniere's disease, Okay, alkaline dieting can really help you a whole lot. Low alkaline dieting, low salt diet. What is alkaline dieting? Eating 80%, making sure 80% of your diet are mostly are alkaline, either moderately or highly acidic, and just 20% are the acidic foods, essentially the mild and the moderately acidic. Now, all the things we asked you not to eat earlier are the acidic foods. So what are the alkaline foods? Vegetables, a whole lot of vegetables: cucumber, cabbage, carrot, spinach, beetroot, and all that. Blending them, drinking them. And then soup vegetables, okra, using them to eat your food. Very, very important. Okay, and then if there's migraine, you need to take care of it. Some supplements that can help migraine are supplements like zinc, like B6, B12, 5-HTP, relaxing tea, anti-migraine tea, lavender oil, willow bark plus feverfew oil. You can use that. And then lifestyle can help you to get a good handle on your migraine. Okay, if there's anxiety, you need to deal with it. Again, 5-HTP, zinc, valerian root, chamomile, passion flower, B6, B12, fish oil. All this can help you overcome anxiety. All this can help you overcome anxiety. All right, and then alkaline drop also. Alkaline drop will really help you to overcome anxiety. Now, if there's stress, you need to also deal with it. We've talked about stress. And then if there's depression, you need to deal with it. If you are battling depression, St. John's wort, vitamin B complex, magnesium, calcium, zinc, B6, B12, 5-HTP. These are the things you can use to deal with depression. Okay, do tests and check your PCV. If it is low, you need to find out why it is low, and then work with a doctor so that they can do an investigation. Maybe they will do occult stool tests and several other things to check why it is that you are having low blood levels. Okay, avoid some other things to do. Avoid operating a machine or driving if the dizziness is really bad, so that you don't hurt yourself. And then don't change positions suddenly. Don't change positions suddenly. All right, and then drink about 4 liters of alkaline water on a daily basis. Like I said earlier, you can get the alkaline drop with which you can alkalize your water. All right, and talk to a doctor. Let them investigate you. Chronic dizziness calls for extensive investigation. Exercises is important if the dizziness will allow you. Taking a walk about 30 minutes in the morning, 30 minutes at night, I found it to be very useful for my patients. And then sit there. If you're having a spell or an attack of dizziness, you might need to just sit down and relax so that you don't have a fall, or you quickly lie down. Okay, and then when you are climbing stairs, use railings, or you use walkers or canes if you are walking, so that you don't have a fall and hurt yourself. All right, that's all the material I have for today. Do not forget, you need to subscribe to us, and then you need to also send this URL to many other persons. Somebody you know is dealing with dizziness, this can help them. Okay, and then if you need us to consult for you, or to consult with you, we do teleconsulting, and then we can tell you the things to do, or to purchase or whatever. Also, we are doing these trainings around medical health, natural health, and it's a 3 days training, second Wednesday of every month to the Friday of that same week. Wednesday, Thursday, Friday. It's a paid training. If you want, we do it every month. Okay, if we have 2 people, we'll do it. If we have 3 people, we'll do it. If we have 4 people, we do it. And if you are out of Lagos, we can do it by Zoom. Actually, we can do it by Zoom. Only you will bear the cost of your own data. All right, so that's all right. We also have our books, Sickness Free, fail-proof protocols for retaining and regaining health, reversing diabetes naturally, and then reversing depression naturally. There are other books. One of my friend Dr. Ekele's book, Living a Disease-Free Life, and there's also Itoro Bright. Itoro is my associate. Itoro Bright, our book is Make Your Food Your Medicine. All those things are available. They can be sent to you in any parts of the world. Please do not forget, subscribe and follow us on Facebook, Dr. Chris Williams on YouTube, and Chris Williams on Facebook. And then don't forget to send this URL to at least 3 or 4 persons. Okay, very, very important. You help us do this. Thank you so very much for watching. We are developing an estate. It's an estate that will be heavily built with healthcare gadgets. Okay, literally where people will they will enjoy part of what we do as residents of that estate. Okay, we are in the first phase now. Lands are being sold, and if you are interested, you can call us, and then soon you will see some adverts concerning it on this same channel. Okay, thank you so very much for watching. Bye bye. God bless you.